Hi, Tiffany Ashton with ClinEssentials. I'm here with another video, and today's topic is tips for reviewing a study protocol. So, we all have seen study protocols, and those are basically the guidebook of what we should be doing on a clinical research study. Every study, phase 1 through 4, will have a protocol of some sort. Some protocols are shorter than others, but others can be over 100, even 200 pages, depending on the complexity of the trial. Now, when you first are looking to review a study protocol, you need to make sure that you have the most recent version. Sometimes there's protocol amendments along the way, so you want to make sure that you're pulling the most current version that is applicable and active on your trial at that time. Then you want to start from the beginning. It's usually best, sometimes people have an electronic version on their desktop or on their computer. I am old school and I like to print mine out. And so with that, when I print out my own copy, I'm able to highlight, make notes, flag different pages, so pages that I can easily refer back to. I always want to go to the schedule of events because I want to know what's going to happen at screening versus the randomization visit versus the end of treatment visit, etc. So schedule of events is one that I always have flagged. But let's take it back a step. And let's just say you have a protocol right there in front of you. Look at the cover page. It has so much information. Is it a phase 1 study? Is it open label? Is it a randomized, double blind? Is it multi-center? Is it single center? Who's the sponsor? All of this information is on the cover, on the first sheet of the protocol. So if you just had a protocol title, you can guess what is going on. It's a phase 1 type 2 diabetes study. It's randomized, it's double blind, and it's multi-center. All of that can be found within a protocol title. So you always want to pay attention to the protocol title. It gives you just a quick snapshot of what's going on with the protocol. Also, we'll have the version date, and we'll have also the version number. So version 1 dated, today's date. So that's the cover. Then you always have the table of contents, and then you want to dive into it. Always take a look at the background and rationale. Why are we doing this study? What is the premise? Are they testing a new product? Are they comparing this new drug to the standard of care? What is the reason? What is the rationale for doing this study? That's key. And it's really key for your own awareness, because sometimes when you're talking to someone and they say, oh, tell me about the study, why are we doing it? And you could just quickly say, oh, we are doing it because there's an unmet need in this patient population, etc. And that's based off of the protocol rationale, background and rationale section. The next key section within the protocol would be the inclusion-exclusion criteria. And so that is what the eligibility criteria for the patients under study. So is the patient, do they have to be between a certain age? Do they have to have a certain disease? Do they have to be on a certain medication? That's the inclusion. And then the exclusion would be things that would exclude them from the study. If they are on 5 medications, they will be excluded. If they've been on this medication, similar compound before, they would be excluded. So those are key to know. And you want to go step by step, one at a time. Make sure that you understand each inclusion and exclusion criteria. Sometimes there's a lot of information within it. Make sure you break it down. And that's why it's very helpful when you have your highlighter, you have your pencil or your pen, and you can make notes in the margin to really break down what that exclusion criteria says, because sometimes there's a lot of protocol deviations because that inclusion exclusion criteria was so combust or compact that you forgot, oh, and a patient with this particular ailment is not eligible, and you missed that little piece, and that makes the patient overall ineligible for the study. So that's another key section. So we have the background and rationale. inclusion, exclusion criteria. Then you want to go to schedule of events, and then you want to also pair that with what happens at each visit. Some protocols say at visit 1, this happens, and it should mimic the schedule of events, but sometimes the schedule of events has more details and just a good overall picture that it's easier to see the schedule of events and go through the schedule of events than just reading a paragraph about what happens at visit 1, visit 2, etc. So that's another key section. You want to look for any prohibited medications. That's another key section. And then you also want to look at adverse events, serious adverse events, and adverse events of special interest reporting. You want to also look at drug and how the drug is administered. These are the key sections that I am pointing out to you. Of course, you should read from the front all the way to the end, but if you had to quickly pull out some key sections to familiarize yourself with the protocol, these are the key sections. And you may, at the beginning of the protocol, have seen the synopsis. The synopsis is a really good summary as well of the overall trial. And sometimes when you're reading the synopsis for the first time, things don't make sense until you start going into the inclusion, exclusion, the background and rationale, the schedule of events, and see a bigger picture. So you also want to include the synopsis. Maybe start with the synopsis, then go into each of the sections that I mentioned, then go back to the synopsis and see if things now make sense. Things that you may have flagged as a question become more evident now that you read more. So these are just some tips for reviewing a protocol. So hopefully those were helpful, especially those new to clinical research, study coordinators, CRAs, even CTMs that are new to clinical research and they are just getting their feet wet and trying to really analyze how a protocol should be read and understood. And remember, your protocol, you should know that like the back of your hand. So always either have an electronic copy or have your printed copy available that you can quickly reference. And so that's why it's key to have those sections identified that you will quickly reference to on an ongoing basis, because there will always be protocol questions. As a CRA, as a study coordinator, you're always going to go into that protocol and say, what happens at this visit? How do I administer this drug? What temperature should the drug be kept at? All of those things. Those are very pertinent details, and you'll find those details and more explanation in the protocol. All right, well, thanks so much for watching, and be sure to like and subscribe, and we'll see you back for the next video. Bye.